Okay,
Okay,
so
it's
the second
recording.
video, correct?
Yes.
Okay, let's see.
And it's recording as well, so I don't know if that can post it.
I don't know why it's not allowing me to share. 1 second. Okay, I found the way. Sorry. Okay. That worked. Thank you.
Okay.
We're good to go, I think, right?
I believe so.
A ver.
Yes.
Look at you.
How's everyone
We're
doing?
doing it.
We're live already. So welcome to La Pinche Rona.
I like the emphasis.
Just know that you can comment on the live video, post your questions, comments, emotions. And so
Emojis are counted for expressive emotions. Well, emotions. So
yes. Yes. And so a little
can
bit
Sol
about,
hear us?
huh?
Yes.
Oh, okay. There you
Yes,
are.
but I'm logging out. Are you guys live?
Yes, we should be live.
Yeah, we're
On
live.
my page.
Okay. All right.
By the way, I like that book in the back. That book is my favorite. I Am Enough. Y'all see it?
Yeah.
So that was Sol. She made a cameo. Yeah. So my name is Allilsa. I'm a peer specialist in a hospital. I've done a lot of mental health advocacy work for 11 years. And we'll get into presenting our presenters today. So Marisol and Tabitha, if you want to share with us like who you are, what you do, so forth.
You go ahead, Tasha.
Okay, all right.
And I
My
said
name is Tasha James. I'm out of Houston, Texas. Actually a South Texas native. I'm a bilingual therapist and I work with youth. I also work in the ER. I actually complete evaluations, mental health evaluations in the ER, but I also, my private practice, I conduct immigration evaluations or psychological evaluations for clients that are seeking hardship, U visa, asylum cases are pretty much the majority of the cases that I do. I do see clients in detention centers, but I've been in the field for like 15 years, licensed a little over 5, but I've worked in the social service field for a very long time, particularly in sexual abuse. I was a forensic interviewer for Harris County and conducted about 5,600 forensic interviews of alleged child abuse cases. So I'm very familiar with the forensic component of evaluations and interviewing. Marisol.
So my name is Marisol. I am a bilingual counselor in Houston, Texas as well. I do, I work at a nonprofit providing free counseling services and also have a private practice that I do part-time, mainly individual counseling, but also do immigration evaluations, kind of same along the lines that Tasha was saying. But mine, I get more hardship cases than asylum. So it kind of just depends what the clients are looking for. I've been working in this field for about social services for about 10 years, actual counseling the last 3 to 4 years. So it's very interesting to see how the field is changing. And I think right now we're seeing such a big boom on the changes as well.
Speaking about changes, what are some of those changes? Because we know this whole situation with the pandemic has caused a lot of sudden changes.
It definitely has. I think the biggest change has been the move to everyone doing teletherapy.
And what does that look like now? Is that different between different communities? Is that a struggle for some clients? What does that look like?
And if I can chime in, I think it's a struggle for everyone really right now because the changes have happened so abruptly. There are several clinicians, or there's quite a bit of clinicians that their practice is face-to-face. And so we're having to adjust to the need of the client by moving our platform from office-based to teletherapy, which is via computer. It's a video session that you would have with the client. And there's a lot of things that even just in private practice, a lot of red tape that you have to go through when you're wanting to implement insurance or being on panels. And I don't want to get too technical, but I think right now with such an abrupt change, it's moving the world of psychology in a way that we were already behind, but it's kind of not at our pace, but at the pace of the times, if that makes sense.
Mm-hmm.
It's going to be a very interesting adjustment period for folks. All the way around.
It is. I think along those lines, for the clients, it's something, at least in my experience, that they've been hesitant to do. They're like, oh, I don't feel comfortable with doing that. And there's a lot of different reasons this is happening, because maybe they don't have a private place to talk about whatever their problems are from home. So it's very uncomfortable to open yourself up. So I think one thing that we're seeing, and it's maybe not like automatically in our mind, is that a lot of the clients that we're now seeing in telehealth, we've essentially, this pandemic has taken away their safe place, which was outside of the home. Because what we do know is that home is not a safe place for everyone.
Mm-hmm.
So like we forget that. And I think it's been talked about a lot in the news that maybe there's a possibility of a lot of the child abuse cases going up, a lot of domestic violence cases going up, because these other safe places such as schools, libraries, other community places, therapist office, they can't go there anymore.
Mm-hmm.
So
and we know, like for the Latinos community, the Latinx community, particularly like with my own family, I told them, hey, download Zoom so we can all connect. And they're like, what? ¿Qué es eso, mija? You know, like,
yeah.
They're lost. Do you find that Latinx community, when it comes to telehealth, navigating that space is more of a challenge? Has it been more challenging for them?
My mom still has a flip phone. We've been trying to get her to change it. No, mija, it's something so familiar to her. And what we know that familiarity is a safe place for people, right? I have my routine. This is safe for me, and that being so abrupted, then that can create anxiety. Excuse me. So I'm sorry. Show me some grace. I'm literally in a live, and my child is asking me to do something. This is
real life. This is what's going on right now.
Yeah.
Many therapists. Because
no, I hope everyone else can empathize. Show me grace. I'm showing myself grace at this moment.
Yeah.
Therapist me and me have to remind myself, don't do it. But yeah, I think some are gonna struggle with it, and it's so new, and a lot of times something that's new is very uncomfortable, and it may not feel safe. But I think the disparity may be not having the access. If someone has a flip phone, they don't have the ability to do a video session.
Yeah. My what I'm struggling with is that, for example, with my Spanish speaking clients, if I direct them to Simple Practice, their website is not Spanish friendly. So even if they know how to read and write, their instructions aren't in Spanish. So it's like, okay, you're doing a disservice to me, to my practice, and to my clients, because they don't have the same accessibility that my other clients have. So having to figure out, okay, what's my backup plan? I'm paying for this service, but I need an easier backup plan for them where it's just automatically like click a button and I can talk to you. So these are things I think other clinicians don't have to think about because they don't have that language barrier. So at least that's something that I'm seeing with the clients that I do have.
And some platforms may not have documents in Spanish, so we're having to translate those documents. If you're going to the telehealth or video, having video sessions, and there's been some lacks as far as confidentiality, using different platforms that normally wasn't used before. But you still have to put in place consent and what that looks like, and if we're having to become very resourceful. But I think there's a lot of dynamics that are impacting our Latinx community.
And we have children too, like not me per se, but like a lot of families have children. How is that impacting people when they're doing telehealth or therapists when they're communicating with their clients? Obviously, right now is for a lot of families is not the time to have a babysitter. You know, it's not easy to get someone to come in and have that space. So what does that look like?
I mean, generally you want a session to be, you don't want it to be interrupted because it interrupts the flow and the energy. And so it is going to be difficult. And a lot of times, really right now, people are really thinking about their hierarchy needs. Like, I need to get food, I need to make sure I have water, maintain shelter, people lost wages. Do I go to therapy or do I try to figure out how do I not get evicted?
Yeah.
And so with that alone, like myself and my other co-owners of our private practice, we're working on trying to put something together to a how-to letter. Like, this is what you need to give your renter, and hopefully manage. But those are things that right there is therapeutic. That addressing the crisis is therapeutic.
Yes.
And so for different communities, the scarcity or the lack of resources alone is already traumatic. And then to have to impose ourselves in, well, I'm moving to this platform, this needs to work, right? We're going to make this work. You know, there's time and place for everything, but I think ourselves as clinicians are trying to adjust to this, what's happening. None of us have control of it. And it's not an isolated, everyone is right now experiencing the stressors of it, but of course, people at a different intensity.
That is so true. And either of you going into work right now?
No.
No. So we are working remotely. My full-time, we're working remotely and still trying to communicate with or keep in contact with our clients. And that looks very different from face-to-face. For a while, it was just telephone, and they finally approved video sessions or telehealth, but we're not. So, you know, we don't want to jeopardize their health either.
Yeah, I was just wondering, like, mentally, what it looks like for people to still have to go into work right now.
I think, you know, yesterday we talked about it. I'm feeling conflicted because we are customarily running to the crisis, right? We are, that's that's in our spirit, that's just our being. And it has been difficult for me not to be out there because my job has always been very crisis oriented. I'm always a kind of the person. But in this case, I have to be mindful that some of my clients don't have access to insurance. So if I expose them, what am I jeopardizing? I'm jeopardizing their livelihood if they get sick. those in their home. They can lose their job. So there's a domino effect.
Mm-hmm.
It has been difficult for me not to be able to go out there, if that makes sense. I don't know how it is for you, Marisol. I know you work in a church.
Yeah, it's been difficult because I know, like, some of my clients, I'm the only other adult they'll talk to. And then coming with all the stuff we've been working on and seeing, like, it's been at the ones that are unable to access telehealth. Okay, well, how am I going to help them? So, like, it weighs on my mind, like, dang, I can't, like, we've been making so much progress, and now it's just like, okay, what do we do? And then the added stress of, like, what's going on right now. I do serve a very low socioeconomic area. So those are our restaurant workers, our people that go clean houses. So their jobs, they're like, okay, I'm stuck in the house. I don't have the resources that I need to help myself, to help my children. So all that is like, okay, now what can I do to help them? How can I help them? So it goes back to what Tasha was saying, that we're usually out there helping, and now we're stuck to it. And okay, what do we do, like, from our homes? How much can we do?
Mm-hmm.
You know what's coming to mind? Survivor's guilt, right? Because I'm coming from a place of privilege, right? I don't worry about my wages. Well, I think now, we have to anyway. But anyway, so I'm coming from a place of privilege, right? And so that survivor's guilt kicks in as well. That if I ask a client to meet and they get stopped, we're in a
shelter in place.
Shelter in place here in Houston. If they drive and they get stopped, what is that going to do, especially if they're undocumented, right? And so there's so many complexities, especially with the population we work with. I mean, they're my people, right? I'm Afro-Latino. So those are things that maybe other therapists may not have to worry about. If they get stopped on the way.
How do you see the Latinx community responding to the pandemic? Because we know that we've come from a place where we're communal. We're not individualistic. Like, we've just learned to share amongst each other. Like, our survival depends upon sharing with each other. So how do you see the Latinx community responding to this pandemic?
Well, in most cases, some homes already have, like, it's a multi-generational home. So they have that support, but if there's abuse, or there's maybe some isolation for whatever reason, I definitely exploring with clients, what can you do in this time? I know that maybe you're very connected to your church. Are there church members that you can call, or at least one person really becoming creative on what protective factors are out there for them? But I think if we have families that generally meet, and this is their family time, and the weekends y las asadas, right? We can't do those. That can create isolation. You may even have a house full of folks, but que toda la familia se juntaba los fines de semana y eso no se puede hacer ahora. That can be very devastating. That can bring fear, anxiety, maybe some depressive symptoms. But I don't want to take over, but I mean, Marisol, a lot to that too.
Yeah, it reminds me, like, just speaking with my friends of, well, I can't go. One of my friends like, well, I can't go, like, pick my kids up from, like, it's my weekend with my kids, but I can't go because I'm afraid I'm gonna get pulled over. So it's like, what do? I still want to see my kids, but we have the shelter in place. So it's very unfair, and that's something, like, we don't think about because we're in a place of privilege that I don't have to worry about that. Because I can get a fine, I'll deal with that, but what about someone else? So there's a lot of things that are not in other people's minds. And then also just those get-togethers where usually in Latinx families is we go to this one person's house every weekend and we catch up and we're just very communal, and it's a place to like release stress and just have those get those, what does Virginia satire say, we need 12 hugs a day to survive or something like that, or
Yeah.
thrive.
Yeah,
We're
yeah,
not getting that. And we're
and
if,
I'm glad you say that, because yeah, and I'm glad that you say that. In our culture, that is something that's so innate to us.
Yes.
Not only our communal setting doesn't just look like estamos juntos, but el abrazo, el beso en el cachete, right? Thinking all week I have been wanting pan dulce, right? Like all week, and all of a sudden, all the weeks that I want to have pan dulce, I can't go. And I'm thinking about every time I go, it's nostalgic for me, because I grew up, I spent a lot of time with my abuela, so that was one of the things, going to the panaderia and the smell, right? And so those things that are so essential for us, we weren't able to do that, right? Those keep us sane and keep us connected to others. And this pandemic, I've come to realize, I was reflecting this morning, we're so interconnected in everything. You know, we're thinking about our farm workers. They're steady going to work.
Yeah.
Ordering my food, right? The privilege of ordering online and have it delivered, but not knowing that, I mean, the privilege again, checking my privilege, that they're still going to work. And they're probably stimulus that's coming out, they're likely not going to see it. So those are things that our community is experiencing.
Do you think that trauma can coexist with resiliency? And if so, how so?
That's loaded. That's a great.
It is.
That is so
a good question.
You know, absolutely. Trauma, you can experience complex trauma, right? And so, you know, yesterday we had chatted for an hour, not even knowing that the time had passed, but trauma, the lack of having access is traumatic. But what do we do? Vamos a la curandera, a la hierbería, right? Those that are traditional things that we've practiced. So that's where the resilience part comes in. And so I definitely think it coexists. And for some, that's how we continue to push through our day. Now, are there some dysfunctional behaviors? Absolutely. But of course, with therapy, those are things you address. But they definitely coexist.
Yeah, I agree.
Mad at ourselves for being able to thrive in that sense, because we're still here. We're still in the living. We're still among others. So yeah, I definitely think it does coexist.
Which I think what you brought up about the curanderos is, I think as a Latinx therapist, that if my client comes to me and tells me this is what I'm doing to help myself, I'm not looking at them like crazy, like, what? You got a huevo and you did what? Or you know, all the different healing practices that traditional healing has. And like reminding them that that's still okay. Like traditional healing and therapy can go together. Therapy is not something that's new. We might call it something different and we might use different terminology, but we have to remember that culturally, we've gone to other people to talk about our problems. We don't call it, they've never called it therapy, but now it's something more official. Yeah. But it's happened. We've done that. We had our elders to go to. We had people that we looked up at. And the curanderos, and this is kind of going off topic, but I was watching this, University of Mexico has a course on curanderismo and mental health. And I was watching it, and they did they were showing us how to do una limpia. And it was just very interesting. The things that we're doing was like what we called grounding, what we called deep breathing, coping skills. And I was like, we've been doing this. We just call it something different.
Yeah.
So to me, it was like mind blowing. But I got a little off topic, but I think
No,
we've
you know
been
what?
doing the
I'm
work.
glad that you're speaking on that, because I'm processing what you're saying. Growing up, that's something that it was very common for my grandmother to do. Abuela, me siento mal, me dejo una barrida, right? That was her, and those things, maybe it didn't work or not, right? But it brought in faith and belief and positivity. So we have been already practicing positive psychology, right? Everything that we see now, indigenous people have done it, and our ancestors already done it. So it's the scientific part had to say, well, yes, this does work, right? Because we're very research driven. Our fields are very research driven. But the great thing of having therapists of color is that we can honor those parts without judgment and validate that we can do that and we can do this, right? And maybe redefining certain things that, okay, well, this may need the support of the clinical part, if that makes sense. And so having clinicians of color is so essential, but I think also the mentorship, because we need more.
Yeah, I was thinking when I'm thinking about resilience and trauma, I'm thinking about the Latinx community being and experiencing this pandemic. There's a lot of feelings, a lot of emotions, a lot of commotion, but somehow we're also resilient to say, hey, la vecina no tiene comida, let me send her. Or, hey, somebody else can't get the grocery, let me send my youngest son to go take it to them. And somehow our communities have uplifted each other. Like I'm seeing these mutual aids and these for people for color, food drives, and all these things. And it's like our communities have had to almost learn how to be resilient in the trauma. So Hurricane Harvey, Hurricane Maria, like time and time again, our communities are not left to just mourn, but it's like we have to mourn, and at the same time, we got to act, we got to survive, we got to do something to uplift each other, or we're going to die.
Correct. So I think I think of like intergenerational trauma, right? On top of that is with that is the resiliency part that is innate. It's in us to automatically go into I just don't take care of my house. So what does my community need, right? What does community need at this moment? Because we know we're in it. We know the specific needs. Our needs are going to be different and unique than from other communities, right? My other communities may not have to worry about driving and being a doctor to access free meals at a school for their kids, right? They may not have the transportation. I don't know here how Metro is happening. I think they've reduced or has a different schedule to access, to get around the city. I don't know what that's looking like more now that we're in shelter in place. But I'm sure the community is coming together somehow to provide or access even the essential things as food, water, toilet paper. This toilet paper is a hot commodity now.
That's crazy.
But I know yesterday we talked about how our ancestors used music, our hair, braiding of hair to give, send messages, right? Even to hold food, rice. So in the trauma, we learned that they are not going to do it for us. How do we do it for each other?
Yes.
And become so creative. That's why I think this year alone, women of color have been like the forefront of entrepreneurship. You have a big movement with that, right? That, okay, well, we have to do it for ourselves continuously.
Yeah, it's creating that opportunity for ourselves, creating that table, creating that space that we're not just going to sit here and wait to get this opportunity, create the opportunities for ourselves. And then we bring others in with us, because if not, we don't see that movement, like that progression to move forward.
Yeah, and right now,
Go ahead.
speaking about community and community impact, I've noticed that in color places, like here in New York City, it's the Bronx. The train is supposed to pass like every 5 minutes, so then it can be spread out, and then not a lot of people are commuting together. But in color spaces, like the train is taking forever to arrive, so they're having to cram each other. Like I have a friend who started reporting that. And then you're seeing the governmental hospitals are suffering at a higher rate than private hospitals. Like they're not being given the supplies they need. So I'm wondering how is that going to impact our communities of color? What does that mean for the nurses of color? What does that mean for the doctors of color? Because they're attending pretty much their color community.
What's coming to mind is that we may not see the mental health component, the onset of it, until the pandemic, like when it's gone, it's over with. Because a lot of times the onset of trauma can happen after a traumatic event. And just to do a little psycho ed, trauma, you can experience trauma indirectly. Watching the news daily about COVID is traumatic, right? And so that is an indirect trauma. And in this perspective, when they're in it and they're in the trenches, they're not coming up for breath to even recognize it. So after all this passes, then you'll start to see the onset of the psychological. You may see some stuff now, but really where you'll see like pockets of, oh wow, it's intense, maybe suicide, or maybe substance abuse increase, depression, anxiety, adjustment disorders. But right now, we're so in it that yes, you see all this bombardment of mental health, but people are not thinking about that, which is a very normal thing. People don't think about their mental health as part of the whole. And so, but I think unfortunately our communities and governmental where these hospitals are at in the location, they're not going to be in the limelight, and that's nothing new, unfortunately.
Yeah.
And it just reminds me what you're saying, Tasha, that right now everybody's in survivor mode. Being in survivor's mode doesn't allow you to kind of process what's going on. So like you were saying, once it ends and once we start going into just that like regular daily living, your body's gonna be like, oh, I don't gotta have like this wall up, so let me try to heal myself. And that's when all this other stuff is gonna come up that we've kind of been pushing down because I don't have time to deal with this right now. I need to attend like what's going on right now, and I don't have time to think about whatever's going on over here.
And so right now people are functioning in the state of fear, right? So Marisol is talking about the flight, fight, or freeze. And so right now people are in the fight, which is our first responders, right? They're there. I'm there. I gotta show up. I don't want to show up. I'm scared for my life, but what am I going to lose my job? Am I going to lose insurance? What if I get sick and I lose all of that? And then what if I get test positive? So there's so many layers, right? And so like I'm saying, my mind cannot wrap my head around all that I'm feeling, but I do know that I'm fearful and I'm scared, right? Maybe more common things that people can verbally express. They have a word for it, but for like our community, Latinx community, the way we describe fear and anxiety is more somatic. Like bedroom, palpitations, siento como que me da un ataque. And so that's anxiety. That's what anxiety looks like, more of the somatic. And when I say somatic is such a big word. When you start feeling physically, that is anxiety.
Mm-hmm.
And we know that our communities have lack of access to mental health as it is. We know that this impact is going to be absolutely huge. I have no doubts it's going to be huge afterwards.
Mm-hmm.
So what does that mean for our communities? Because we already have lack of access. So now you're going to have doctors of colors, nurses of colors, frontline workers like your transportation driver, your cashier register, your delivery person who's had to live with this fear and survival mode consistently. You know, what is that going to mean for them, you know, once this blows over with the lack of access?
Really, having these conversations allows us to process who needs to be included when this is over, that needs to be reached. It's, yes, our frontline people, our healthcare workers, but our delivery drivers, something that people probably never thought to consider to offer them mental health, or like therapy or counseling or just mental health wellness. Like this has to activate and normalize that mental health wellness needs to be in any business and every type of service that's being offered, because we're so interconnected.
Mm-hmm.
When I say so interconnected, today I was watching the news, and there's a famous bread place here, and they've been in business for like 80 years. And she's in tears describing how they're in debt. They're in high debt because of this. And she's showing the box of pie, right? She says, when you buy our pie, you are paying the person that made this box. Not only are you paying the person that made the box, you're paying the person that made the sticker, the decal. So I'm thinking, oh my gosh, like this is so deep. This pandemic is going to affect folks that we would fail the human race if we don't address it at all levels, as far as, like you said, the drivers, our janitors.
Yes.
Yeah.
Our gente que hacen, que limpian las oficinas.
Yes.
Behind, when the offices are closing, guess what? They're probably disinfecting those buildings, but are they provided with PPE? What are they being offered? Are they being offered
Hazard pay?
Like, you know, like what?
Not even the ones in the oficinas, the ones in the hospital that nobody wants to clean. Like after these people have passed away from COVID,
Yes.
nobody wants to go in there, but they still have to go in there. They still have to go clean. They're not
With all
giving the
protective
same
gears.
PPE. Yes, just your regular gloves and a makeshift mask or something. They got to go in and expose themselves and clean something that they know just killed the person that was here.
For minimum pay, by the way.
For minimum wage, probably not getting paid overtime, and it's ridiculous.
And then they're not even offer mental health. So I actually heard from someone that was cleaning. I went to the hospital recently because I had an asthma attack. And this guy is just cleaning, a person of color, by the way, and he's cleaning, and I overhear him say, he's like, I'm so scared. I don't know if tonight I'm gonna make it back home. And wow, like that hits me in my heart, that hurts me. And he has to go through that every single shift. And what does this mean after this pandemic, when we're gonna go back to like, hey, for the community of color, it's always been lack of resource, and we're just gonna continue that. I don't think we can go back to that. I think that now is a good time to acknowledge like our people is going to need this help and support.
I think one thing that we touched on is creating that ourselves. Like, who do we talk to? How do we create that to screen these people? So because maybe they don't even know that they having symptoms of anxiety because they're physical symptoms. They might go to the regular doctor, I have this headache that can't go away, or have this stomach ache, or I can't breathe. But the doctor, we know that doctors with people of color might not take us as serious as other races. So they were like, no, you're fine, take this pill. But they're not recognizing it. Wait, what if it's a mental health symptom? What if it's really anxiety or depression? How is that presenting itself somatically? So like having, like talking to the organizations like our community centers, maybe food banks of, hey, people got to register to get these services. How can we screen and let them know, hey, maybe you filled out this questionnaire or something. How about you talk to somebody about this is what anxiety is, or maybe you have this. Let's connect you to a counselor or someone else that can help you. So starting to think about that and bringing it to the table, because I don't think the people at the table are even thinking about this.
No, at all. Like you hear this hotline, particularly in New York City, they created this hotline, but it's predominantly for healthcare workers, which is truly understandable. And they have this support system going for health workers, which is amazing and absolutely needed. But I don't see a hotline for the cashiers, for the truck drivers, for the people who's making your food, like
The restaurants. Yeah.
Essential workers right now. Your pharmacist, the people packing the food, not even making it, but just packing it. Like these are right now essential workers. Right now, Instacart, they're going to have a protest upcoming because they don't have the proper supplies. Like they don't have gloves, they don't have masks, they don't have disinfectant, they don't have hand sanitizer, according to them. And it's stressful. They're going in there every day like, oh my God, am I going to get sick and then die? Is this going to be the day that I die? Because they don't have the supplies according to them. But I've noticed that there's no mental health efforts for what we're calling essential workers now, but to me have been essential workers forever.
There's two things that coming to mind right now. That this pandemic, of course, when you are actively engaging or actively learning about the injustices in communities, you know this, right? And there's always still more to learn about the injustices. But this pandemic is going to expose the communities that are constantly being oppressed, right? Not only that, it's going to hopefully push the recognition and the need that now that you're saying essential workers, let's really recognize it as that. And let's really give them the things and tools they need and the pay, right? But another thing that is in the Latinx community, feminismo, right? If I know we have different centers here, we have Legacy, we have Vecinos, there's certain clinics, Clínica Hispana, those are specific clinics that a lot of our communities, undocumented communities go to, and also because it's on like a sliding scale, right? You pay when you see a medical doctor. If those clinics are closed, they're not gonna go anywhere else, right? Because it's familiar, it's safe, I already have this established relationship with this doctor, so that may cause people to not seek help until like they're in dire straits. Enfermos casi para morirse, right? Because, but that's very normal. I don't know if my gente has a high tolerance for pain. We just don't go, we go until we
don't like to go to a doctor until we're dying and are in pain. And it's like, well, had you done preventative health, maybe we wouldn't be in the situation. But I think it talks a lot about, I think there's this, and I guess this is my opinion, there's this kind of mentality of the doctor's just going to give me bad news. Why am I going to go? And it's like, well, that's a possibility, but it's because they're like preventative care is not talked about. It's not ingrained in our system. It's not like, oh, my stomach hurts, I should go to a doctor. No, I'm just going to drink some a 7-Up with Alka-Seltzer or something, and I should be good. That's what they told me. Tomate un Alka-Seltzer, rub some leaks, you're going to be fine. You don't need to go to the doctor.
Penicillina, that's it.
Yeah, the Mexican
Penicillina just
penicillina.
cures everything.
Yes,
Everybody-
and it's funny that you told me because I got sick during this past couple of weeks, like last week, and I was like, oh, I think I have an infection. I was like, we'll go to the Mexican store, get you some penicillina, and I was like, no, Mom, it doesn't work like that. That's not good for our health. We should not just take these antibiotics like whatever. Let me go to a doctor. Sure enough, they gave me an antibiotic, but like we make ourselves sick because we do things we're not supposed to be doing.
And for
And it's just,
undocumented people, I feel like, not I feel, I know is very scary times right now. There's rationing going on, right? Like I have 40 patients and 2 bandages. Who am I going to give it to? That's what's going on. It's not like these doctors are being straight up racist or discriminatory. It's just, who can I give these only supplies that I have? And undocumented people, are they going to get any medical support? Are they going to get help? Like just a few days, I think it was just yesterday or 2 days ago, a young person, healthy otherwise, who could have probably survived this, went into one of the private hospitals. His insurance was not taken by that hospital. So on his way to a governmental hospital, he passed away. So
Well, there's EMTALA. EMTALA, technically, hospitals should not be turning anyone away. That's one of the things that even if someone comes and that's not resourced, that doesn't have insurance, that's what EMTALA was developed to protect the patients that come in. You can't turn them away, right? Especially if they're coming in and well, anyways, they're not supposed to be turned away. And so, but I'm starting to hear stories where people, because they don't have insurance, they're just not even going in. They're not even going in.
So is there any telehealth medicine that can take undocumented people? Do we know about that? Those services or hotlines or some type of services that people who are undocumented can reach out to?
I'm not sure, and I don't want to speak on something I'm not, because that's more of a medical, as far as the telemedicine. And if there's not, that's something to advocate for. But I know that I think PHR is really, PHR does a lot of, it's Physicians for Human Rights. They're very involved in the immigrant community. And so I'm not sure if they're providing telemedicine, but I mean, I don't know. I know a lot of hospitals are offering telemedicine, but I don't know if that's just based if you have insurance. So.
Yeah, that's what I was going to say. This is me assuming because I don't know that there's telemedicine out there, but what's the cost if you don't have insurance? It's accessibility, because I don't think they ask you if you're documented or not, but the cost associated with that, am I going to be able to afford it? Because some of these things I can't even afford, and I'm just like, if I can't afford it and I am a working professional, how can other workers that aren't professional afford it?
Yeah, and I'll share this resource. I do know that Mount Sinai, it's called Mount Sinai Now in New York City. They do have telehealth, and I really like that price. It's only $25. So that doesn't include medication or x-rays or any additional workup. But I think that that's a good way for someone who just has cash, doesn't have insurance, to be able to get some of these services. And the hotlines are completely free. The hotlines that they're giving to the CDC and some of the state ones, I know they're completely free, and they're also not asking for insurance. So I think that that's good for the undocumented community to know about, that some of these services don't require or ask for your insurance. So if you don't have insurance, know that there's services out there. And maybe possibly even further recommendation. So para la gente que nos está mirando, que no saben inglés, que sepan que también hay oportunidades para las personas que no tienen seguro médico, si tienen cash, Mount Sinai Now en Nueva York solamente cuesta $25, el telehealth que vese por el internet, y las llamadas que están teniendo sobre el Estado ahora mismo también son gratuitas. I think that's good for communities to know. Is there any
Puedo ir
mental health
a
resource
la
for our
página,
community? Huh?
que también uno puede ir a la página de CDC y están dando mucha información en español, lo que se ofrece, para también tener información lo que es COVID, lo que es el virus, porque ahorita se me hace que también hay muchos mitos, que la gente realmente no está escuchando mucha cosa de aquí, de allá, y que es mejor que vaya uno al CDC, a la página, y para que aprendan cómo uno puede saber más del COVID.
Tener información que cierta, que sabemos que eso es lo que es y no información incorrecta que nos puede poner en peligro. Y las páginas también están en español.
Oh, that's good to know. And is there any free mental health resources for our communities?
I think it depends on where
Or
you
any
live.
low cost, affordable cost?
I think it depends on where you live. They can call 211 and see community health centers. Catholic Charities has a lot of offices nationwide. So reaching out to Catholic Charities, they do provide low cost or free counseling. That's the only one I know that's nationwide. A lot of churches have sometimes counseling in the churches, depending on the church. So yendo a caridades católicas o a las iglesias o llamando al 211, ahí pueden agarrar más información para la salud mental.
Y el centro de Harris también ofrecen servicios, por ejemplo, para los jóvenes y también los adultos con IDD, lo que es si alguien ha estado diagnosticado con bipolar o depresión, pero si uno tiene Medicaid, si un joven tiene Medicaid, uno puede ir por el centro de Harris y también ofrecen los servicios en español. Pero estoy pensando en Legacy, eso sí está en la área de Houston, en muchos lugares, partes de Houston. Vecinos es otro centro que ofrece terapia, consejería. Depende de lo que uno pueda pagar. Si uno no tiene seguranza, uno puede obtener terapia por el centro de vecinos. So, I mean, there's a few agencies que están aquí en Houston.
Yeah, because I'm thinking about, again, our essential workers, our farmers, who most times are undocumented, but they are forced to hard labor, hard hours, and right now it's probably 10 times worse, most likely. So where do they outreach to talk to somebody? Cashier workers, again, transportation, truck drivers. Where can they turn to talk to right now and say, hey, I'm struggling, I'm going through this. I'm just wondering, where can they turn to, especially if they're not insured, because what we mostly know is that these jobs, like Walmart, that they were fighting for was insurance, health insurance. Because the thing is that the government says, if you make, let's say, $18,000, or let's say, for argument's sake, $19,000, you no longer qualify for Medicare because you're making a few little dollars over. But then that person's paycheck goes to rent, to light, to transportation, to everything else, and then they don't have enough for the copay and everything else. So it's like, it's a struggle. So a lot of people end up being uninsured. So
I'm trying to think as far as like the resources. I think the three of us were in that webinar on yesterday. I don't know if you have the whole name, Marisol, or that was a really good webinar, by the way.
It was. I'm thinking right now, la línea de ayuda para depresión, which is different from suicide. suicide
Uh-huh.
hotline. It's one,
Mhm.
and then they have the depression one. So that somebody they can talk to, and they usually have people available in Spanish as well.
Ooh,
NAMI,
awesome.
NAMI también es,
Mm-hmm.
ellos también, la página de ellos también uno puede, la información lo puede uno escoger en español.
The other one was the National Hispanic Trauma Network of. It was really long.
Yeah. Yeah. I mean, I think what we could do is just kind of after this, put it somewhere on the links,
Yes.
post them. And then, but I definitely, I'm glad to have this opportunity to just chat about what we're seeing and what our concerns are. I just thank you for even asking me, and I've done other things with Marisol, and it's always a pleasure to chat with her as well. And I think
Definitely.
we're seeing also, and I speak from also being a therapist, that this week has been very, I've been feeling very unrooted. And so one thing that people may not recognize is that there's trauma reminders that are being activated. If you've been here before, if you've been through a disaster before, trauma reminders are being activated. And so, but one of the things is that with every emotion, there's a breath connected to it, right? And so that's what grounding is. I need to catch my breath. Sometimes when you're feeling very anxious, it feels like you can't breathe, right?
Mm-hmm.
I was reflecting this morning on that I had been holding my breath all week. And this morning I had to take a deep breath and release everything that I was holding. And people, when we literally say we stand on the shoulders of our ancestors, right? We're our ancestors'
Yes.
greatest dreams, right?
Mm-hmm.
Held so much on their shoulders and their body that the way we can honor them is by the healing and releasing all the generational trauma, right?
Mm-hmm.
I'm hoping with this pandemic that also, I know it's very traumatic, but that there are people that generally did not seek help for mental health or for mental well-being will seek it now.
Mm-hmm.
So
Yeah. So I've added some of the resources in the group chat that we've talked about. It says mountsinai.org, which you talked about in New York, has a telehealth available, and they don't ask about legal status. Also, CDC link en español, se va a ir para la página en español. 211 para recursos en su área, la línea de ayuda de depresión que puedes llamar 24 horas al día. The National Hispanic and Latino Mental Health Technology Transfer Center has the webinar for people who serve Latinx communities, and many other resources, free webinars for any mental health providers that are watching us, and has the link to that as well.
That's awesome. And before we part, what will you say is one thing that you want to leave our Latinx community with? What's one thing you would want to say?
For me, it would be to take the moment and, like Tasha was saying, how do you feel? What is going on inside of you right now? Am I, like Tasha was saying, ungrounded? Because what we know is that our elders, our parents, they don't think about themselves. They think about the family.
Yeah.
So I need a reminder that you need to be okay and take care of yourself so you can take care of others. And what does that look like for you? What does self-care look like? Does it even exist? If it doesn't exist, start doing something to take care of yourselves. Because, for example, I know my mama doesn't do it as many times as I tell her, please take care of yourself. Just don't worry about us. Take care of yourself. No me hace caso. That's a whole different topic. But want to remind people that it's okay to take a moment and take care of yourself, and take 10 minutes to take a breath. Take 10 minutes to kind of be in silence, not around everyone in the family. And sometimes that's seen as, or can be perceived as selfish, but it's not selfish. It's actually providing something that the family needs. Because if we're okay and we transmit being calm to others, then that's going to transmit calm. But if they see us stressed, anxious, and tense, then we're going to transmit that as well. So
True.
that would be what I would like to leave our people viewing us with.
I'm processing. I think the biggest thing that's coming to me is that that the clinicians of color that exist, Black or brown, that we are here from a collective, but also from an individualistic perspective, but it's always connected to our community, and that we will continue to advocate whatever steps need to be made, either small or big, loud, taking up space, making our presence known for the healing of our communities and for the access to the things that we should have. We should not go without, right? But it's going to take also changing the inward, that accepting that we do need those things. We're out here advocating, but teaching our community that we do need this, like we do need this, right?
Mm-hmm.
Are going to honor the collectivism that exists and that is very familiar to us. And that's why we're here. We recognize it. And so, I mean, that's just what's coming to my mind. But, you know, the pandemic, I think, has us all kind of shook.
Yes.
So,
I've been checking the Facebook to see if somebody posted a question. Let me just double check and ensure that there hasn't been any questions. 1 second.
The Facebook did not work. It
went in
didn't
and
work.
out.
Yeah.
Okay, so we didn't have questions.
it's recorded. I mean,
But yeah, we can share this recording, so it's good. Well, sorry the live did not work. We'll figure it out for next time.
what I'm learning is that we have great energy between the three of us, and that it doesn't have to just stop at the live or attempting. I think if we continue, we may come up together, the three of us, with how to advocate for the people that we spoke about.
Mm-hmm.
Yeah. And I if you tongue-tied, there it goes. And if it's okay to ask you, I think it would be great to have more of these conversations. Are y'all up for that in the future?
I definitely am. I think it helps to talk to other like-minded individuals to also see that I'm not the only one seeing this, like lack of resources, lack of in our community and the communities we serve.
Because I know that we had a conversation before this in preparation, and that conversation was so good. I feel like this is just part 2. So
Yeah.
That long, we should just record it.
Right? Yeah. Let it happen organically. And so what I'm thinking as you're talking, you know, therapy or the mental health field, we're being thrust in technology in a way that I think our field was already behind. Like and when I say behind, I'll give you examples. We have a lot of therapists that use social media, and that's how they're getting, putting their name out there, which is good. It's great to reach people that generally would not come to therapy, and still those posting little gems here and there about trauma and relationship. But again, we have to follow these certain guidelines, but now either our field is going to have to catch up with the times, and if it does, we have to advocate that it's still accessible to the communities that served or underrepresented. So if we're going to be thrust into the use of technology, what is that going to look like for our communities? And how to advocate for that because we've talked about not everybody has accessibility, no todos tienen computadora, no toda la gente, no, los clientes no saben usar lo que es el Zoom y agarra este app, esta página, eso puede también causar estrés, right? So,
Yeah.
what
So
are we going to?
I want to actually, I think I'm going to email Simple Practice and be like, hey, I need you to have your page in Spanish. Because this ain't working for me. And I'm paying you.
Yeah.
And their prices went up. So.
Did they right now?
Not right now. They went up like at the beginning of the year. It was like 30, it was like $40. It's like about $60 now. So.
Well, right now we're in a pandemic. They're not going to give us there's no discount. There's no, can you defer my payments? Okay. Yeah, I have Simple Practice, but I've been over it. But yeah, we
This was awesome. Let's keep the conversation going. I feel like there's a part 3 coming.
right.
I think there is.
Part 1, we were talking more about, I wish so badly we would have recorded that conversation because we talked more about the actual community and what that looked like. Maybe we can touch up on that some other time, but I feel like there's so much to say right now within the Latinx community, like so many things that I don't think a lot of people are aware when it comes to mental health. Like just
well, you know, Marisol has a podcast, right? So maybe she'll invite us to her podcast,
right?
I need to record new episodes. I hadn't had time, but now I can't say I don't have time. I got
I've been looking at my house like, I don't want to follow. I've been walking by this one particular room, clean clothes on the bed. I'm like, I don't have time.
So, I can't see it. If I don't see it, it doesn't exist.
Those are avoidant behaviors.
Yeah,
Being a therapist is like a gift and a curse. I'm telling you.
It is.
You be in your head so much like, am I internalizing it? Am I being unfair? Am I reacting? Am I reacting? You're always in your head. So, but
I'm like, I need to stop trying to be my own therapist and just go. I need to make an appointment with my therapist.
Yeah. Hey, therapists need therapy too.
We do. I got her on speed dial too.
Yeah. So.
Conversation. You should definitely do some podcasts on this. I mean, just the essential workers, I think that's a podcast in itself. I mean, that didn't come up until today, which is vital and important. So.
I wonder if I could podcast this and just have this be a podcast episode, this conversation.
Yes.
Because it's recorded. Can you just kind of post it up or?
I'm gonna have to do some research and figure out how to extract the voice.
Yeah.
Okay.
Yeah. But definitely let's continue. I feel like there's a part 3 coming.
Right?
Yeah. Definitely.
Hopefully I won't have any interruptions, y'all. Hopefully.
Yeah, it's life.
And it's part of
being authentic.
Now. Yeah. So if you see some kid or a dog coming in, it's part of my life right now. Like that's what we're dealing with right now.
Meet me where I am. Okay. That's what we meet clients where they are. So
you embrace it. You embrace it. And is there like any website or any information you would like to share with the public before we leave? Like your own private website, podcast, something that people should be following?
Marisol.
So my Instagram, Facebook, and website are all A Bilingual Counselor. That's where you can follow me on Instagram and Facebook. And my website, abilingualcounselor.com or consejerabilingüe.com will take you to my private practice page. My podcast is Oye, Let's Talk. It's a bilingual podcast. Some episodes are in Spanish, some are in English, and some are Spanglish because I'm a Spanglish speaker.
I love it.
So that's on all the major podcast players and on YouTube. So they can find me on there.
Awesome.
So co-owner of Urban Therapy Exchange. We're on Facebook. We're also on Instagram as Urban Therapy Exchange. I'm Masapan Queen on Instagram. And So we're also on Psychology Today. You would search us for under Urban Therapy Exchange. And so right now we just offer the psychological evaluations for immigration cases. Of course, that right now has been paused for some of my cases. So, but yeah, that's where you can find me.
Thank you. Thank
Oh,
you
no,
to
thank
both of
you.
you. This was awesome. I'm looking
Yeah.
forward to part 3. And I should have recorded part 1.
I know,
We're learning. We're learning as we're going.
Yes.
Yeah. So
Thank
muchos
you.
besos, tranquilas, have a good evening.
Bye.
And we'll chat.
All
Yeah.
right.
Bye.
Bye.
Bye.